So welcome everybody for today's session. It's going to be the first part of antimicrobial resistance in One Health approach educator. And our part today is going to be, we are going to discuss how to tackle antimicrobial resistance. How can we define antimicrobial resistance? It happens when bacteria, viruses, fungi, and parasites no longer respond to medicines. Makes antibiotics and other antimicrobials less effective or ineffective. It increases the risk of disease spread, severe illness, disability, and death. It's one of the top global public health and development threats. In 2019, the bacterial antimicrobial resistance was directly responsible for 1.27 million deaths worldwide. And it was a contributing factor in 4.95 million deaths. So how, as youth, we can have our own actions to address antimicrobial resistance through One Health approach? We can bring together stakeholders from animal, human, plant, or environmental health sector. That's all about the One Health approach. It's about collaborating, communicating, and contributing between the human, animal, plant, and environmental health sectors. We can promote communication and collaboration across disciplines. We can design programs and policies, implement intervention. We can work on monitoring outcomes. We can participate in the legislations and research, as our main goal is to reduce antimicrobial resistance and achieve better health and economic outcomes. Okay. The Global Action Plan to address antimicrobial resistance, it was adopted in 2015 World Health Assembly. It composed of 5 strategic objectives. The first one is to improve awareness and understanding antimicrobial resistance, strengthen knowledge through surveillance and research, reduce incidence of infection, optimize antimicrobial use in human and animal health, sustain investment in new medicine, diagnostics, and intervention. At the first, it was monitored by WHO, FAO, and WHA, and then UNEP participated, and it became a quadripartite who's in charge in monitoring the antimicrobial resistance global action plan. Okay. So the quadripartite working group, which is the WHA, UNEP, FAO, WHO, in October 2013, the quadripartite working group of youth engagement for antimicrobial resistance was launched, and it was seeded by the quadripartite partners. Its goals is to guide global effort in sensitizing and mobilizing youth as advocates and champions to fight against antimicrobial resistance. The key initiatives included developing toolkits, and we will share the toolkits via the chat box and our WhatsApp group, organizing awareness campaign like the World Antimicrobial Awareness Week, which is held between the 18th and the 24th of November, and ensuring youth voices are centered to antimicrobial resistance policy making and events. Why youth engagement matters, why youth voices matter, because it makes up over half the global population. Okay, in our countries, more than half of our population now in the MENA region are youth people. So they are essential for sustainable change. Creative, innovation, and tech savvy, which is able to spread the messages quickly. Also, we can influence each other. We can influence our families, our communities towards responsible antimicrobial use, as we did before through the antimicrobial resistance photo competition. So we're going to share in our WhatsApp group the Youth Engagement Toolkit, which the main role is to empower the next generation. It's a practical toolkit created by the quadripartite. As we mentioned, they are the four main partners: WHO, FAO, UNEP, and WOHA, designed to help youth-led networks and youth-serving organizations meaningfully engage young people in AMR outreach. So now, from today, we will start working together, and from the upcoming sessions, we will start working together in order to protect our present, secure our future, as it's the World Antimicrobial Awareness Week for 2025 theme of this year. As we mentioned, it's protect our present and secure our future. And thank you so much.